If you're coming in for an egg retrieval procedure, here's what it's going to look like. My name is Dr. Sharon Moyeri, owner and founder of OC Fertility and OC Biogenics. You'll check in at the front office where you've been coming for monitoring, and you'll be checked into our surgery center, which is just on the opposite side of the waiting room. Our surgery center is fully accredited by Quad A. Once you're moved back to the operating suite, you'll be monitored by our physician, Dr. Chandanani, who uses the most up-to-date anesthesia equipment. At that point, you're going to go through your history and physical again, and I know sometimes that can seem redundant, but we want to make sure that we're not missing anything. Remember, you shouldn't have had anything to eat or drink the night before or the morning of the procedure. It's very important so that we don't have any issues with canceling your procedure. After you've had time to review any questions with the anesthesiologist, I'll make sure to come say hello, and then you'll be wheeled back into the operative suite. At that point, you won't remember much because you'll receive anesthesia, and that's a good thing because you won't remember anything for the next 30 to 40 minutes. It takes me about 30-40 minutes to retrieve your eggs. There's no cuts in your body, there's no incisions. I'm doing this all through a needle, and it's passed through the vagina into the ovaries. Risks to this procedure are very, very low, less than 1%. So I want to reassure you that this is a safe procedure. After your procedure, you'll be wheeled back into recovery, and you'll spend about 30 to 40 minutes there until you feel comfortable and ready to go home. We'll send you home using a wheelchair to your chaperone and make sure that they stay with you for the next 24 hours. We will not send you home with an Uber or a taxi. We want to make sure that you're going home with someone you can trust and that they're there to keep an eye on you for the next 24 hours. And just to remind you, you should have received your post-op instructions before the procedure, and then at the surgery center, the nurses are going to reiterate those post-op instructions and share them with you again. So please take time to review those post-op instructions. We review very detailed day-by-day instructions, including medications that we want you to take, some of which are prescriptions and some of which are over-the-counter. Make sure to contact us for the following issues: any shortness of breath, any fevers, which means a temperature greater than 100.1, or excess vaginal bleeding, which means soaking a pad for more than 2 hours. If you're having any concerns, please feel free to call us. Otherwise, if you have some routine questions, please feel free to message us on the portal or call us if you feel more comfortable. After the egg retrieval procedure, we want to make sure that you schedule your post-op appointment if it hasn't already been done. We want this to be either through a phone call or a video. It's up to you, but we want to make sure this happens 7 to 10 days after your procedure. I'm often asked about what the day of the egg retrieval is like, and I wanted to summarize it for you. It's actually a pretty quick procedure. It's done here on site, and it takes about 2 hours from start to finish to check you in, do the procedure, and send you home. We want to make sure that you're fully prepared and that you're not worried about what's going to happen that day so that you can come with the expectation of what to plan for.